Okay, you've had a total joint, and maybe a shoulder, a hip, or a knee, and you may be wondering, what are the precautions? These get gone over with you in the clinic at your pre-op appointment, but you get a lot of information at that time, and you may forget what you're allowed to do and what you're not allowed to do. So once you get back home, and let's say you've had a shoulder replacement, shoulder precautions are simple. We want you moving your arm. We want you moving it on your body. Anything on your body you're allowed to do. If you need to scratch your nose, scratch your nose. If you want to wash your hair, wash your hair. Use your arms to pick up your pants and put your socks on. Those things are all okay. Anything on your body is fine. What we don't want you to do is reach out in front of you past 90 degrees or reach out to the side of you past 90 degrees. We also don't want you to externally rotate your shoulder for the first 2 weeks until physical therapy teaches you how to do that safely and you start building up those muscles. As far as the hip goes, we don't want you to do anything outside of your hip. So if you're sitting on a toilet, for example, you want everything to be at 90 degrees. If you happen to let your pants drop to the floor and you need to pick those up, you need to lean inside your legs. Make sure your knee is always pointed away from you and your heel is pointed in, and you can do that safely. We'd prefer that you don't do that for the first 6 weeks, but if you have to, those are the things that you can do safely. The same thing if you're standing and something's on the floor, we'd like you to use a grabbing device of some kind, or just have somebody else pick it up. But if you have to bend over, make sure you point your knees out and your heels in.